Welcome to Part 3 of the Vyntus Spiro Quick Start series. In this section, we will demonstrate the proper measurement procedure for a forced vital capacity, or FVC, using your new spirometer. You are already in the measurement application and can verify this by viewing the upper right corner of the program bar. You will notice the radio button for measurement is green. Before performing a measurement on a new patient, you must first enter their patient information. Click on the new icon in the upper left section and a patient information box will appear. Fields with an asterisk must be entered: identification, last name, first name, date of birth, gender, height, and weight. Race is important as it changes the predicted values. The default race will always appear. Verify this is correct, or select the correct race from the drop-down menu. Additional fields such as technician, physician, referring physician, and diagnosis can be entered now or at a later time if you need to perform a measurement immediately. Once you have entered the patient information, click OK to continue and you are immediately taken to the measurement screen. Before patient testing, be sure to put a new filter on the end of the Vyntus Spiro. Now would be a great time to orient your patient to the maneuver you expect from them. Remember, quality data is reliant upon good coaching. The standard instructions for a forced vital capacity should be: teeth and lips are going to wrap tight around the mouthpiece. Nose clips are going to go on your nose. You're going to breathe nice and easy and relaxed for me at first, about 5 breaths or so. You're going to hear me say, big breath in. It's a big, full, and sort of fast breath in. And then I'm going to say blast. When I say blast, you want to blow out super hard and fast. But then you also have to blow long as you can for at least 6 seconds. And then you're going to hear me say, big breath back in. Big as you can, fill your lungs again. And then I'll have you take your mouth off the mouthpiece. Reassure the patient you'll be actively coaching them during the maneuver. So I'm going to coach you through the whole thing when it's happening. So remember, it's normal breathing, in and out, big breath in, blast it out, keep it going, keep it going, keep it going, big breath back in, and then off of the mouthpiece. And that's one test. We'll do at least 3 of those that are the same. Now let's demonstrate this procedure to show how good coaching influences good patient cooperation, yielding a good flow volume loop. Teeth and lips wrap tight around there. Pay careful attention to the coaching. Lips are nice and tight, easy breathing for me, nice and relaxed, just in and out. Couple more easy breaths, you're doing great. It's given in short commands as this test is a very quick, forced maneuver. Very good. Great big breath in. Blast! Keep it going, 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 keep going. Squeeze, 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 squeeze. Don't breathe in yet, don't breathe in yet. Not yet, not yet. Big one. Great job. Sit back and relax. Mouth comes off, nose clips off. Now let's review what that same test will look like on your screen in Sentry Suite software. Ready to go? Select F1 from the left-hand menu. Your screen will change to active measurement mode. Easy breathing. Coach your patient to breathe easily and regularly for at least 5 breaths. Good. Nice and relaxed. Coach your patient to maximally inspire with some speed. Make sure the patient inspires fully before blowing out. Stable baseline breathing is indicated by the appearance of a red dashed line. Once they have inspired to their maximum, immediately have them blast out all the air as hard and as fast as they can. Breath in, blast! Good, hang in there, keep it going for me. Have them continue to blow out until their spirogram tracing crosses the 6-second blue line. Hang in there, big one. And go ahead and take that out of your mouth. You will notice on the graphical guidance to the right that when the patient has met all the criteria for performing an acceptable maneuver, a large green check will appear and you can instruct the patient to take in a full breath. At this point, the test is complete. Click F3 to end the trial, and you can have the patient take the filter out of their mouth and take the nose clip off. Review the trial for acceptability by viewing the quality assurance bar below. The box on the right will review if the test meets all relevant criteria as indicated by the blue rectangle indicating good quality. If the test does not meet relevant criteria, the blue rectangle will indicate bad quality, repeat trial. The area to the left explains why a trial was considered bad quality. To review the flow volume loop, thus the effort, in more detail, click on the data column of the trial you would like to review. In order to assess repeatability, it is recommended to perform at least 3 trials. If you are not familiar with criteria for repeatability and acceptability, please find the ATS-ERS Spirometry Statement Guidelines on www.thoracic.org and familiarize yourself with these criteria. If your patient only blows poor attempts because your verbal coaching is not enough to effectively motivate them, you can also use one of SentrySuite's animation programs. Animation is a built-in program to give your patient visual cues that, along with your coaching, will ensure best efforts. To activate animation, go to the left button bar and select F11. A dialog box opens where you can select which animation program to use. Once selected, simply run your test by pressing the F1 button. Let's take a look at a test using the animation application. So we're going to do the same thing again. You're going to try to blow that ball right out of that tube, okay? Easy breathing for me, nice and relaxed. Doing great. Blast! Go, 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 go. Keep going, keep going, keep going, keep going, keep going. Hang in there. Squeeze it out. Squeeze, squeeze, squeeze. Big one in. Great job. Sit back and relax. Good. So that you just did, that blast, that was perfect. Spot on. That's what I want you to do for 3 trials in a row. This concludes your introduction to measuring FVC using your Vmax Vyntus Spiro spirometer. Part 4 of our series will cover review and reporting from your spirometer system.